Hello, my name is Amanda Hood, and today I want to share with you my personal philosophy of healthcare and nursing, which essentially is that compassion drives excellent healthcare. My philosophy of healthcare in this day and age is that everyone in the U.S. will require healthcare services at some point in their life, which means that we need an organized healthcare system that focuses on healthcare promotion and disease prevention. Every single person deserves treatment if they require it, and it's the job of all nurses and all healthcare workers to provide these services as best we can within the legal and ethical scope of practice that's set by our state and federal laws. However, as a nurse, our job is not only to promote health and provide these medical services, it's about doing our duty in a compassionate way. So I believe that nursing is the daily creation of a relationship with our patients that promotes trust and a healing environment. This relationship is formed through the utilization of critical thinking and clinical excellence that is delivered in a compassionate and nurturing way. Nurses can be taught the ability to prioritize and problem solve, but it seems that a real nurse or a great nurse has the natural ability to empathize and provide comfort to the people around them. The main building blocks of my nursing philosophy are the understanding of anatomy and physiology, how to care for a patient in the most effective and healing way, and how to build relationships with patients, other healthcare workers, and the people in our community. And the first and second building blocks are the basis of nursing, not only because you must understand how the human body works, but a nurse must be able to see trends in their patient's health and know what actions to take if the trend is a negative one. So you must be able to think critically and balance various treatment options with the patient's overall health and possible reactions to the treatment that you give them. The third building block goes back to a nurse's ability to provide this care in a gentle and caring way, which fosters a healthy nurse-patient relationship. If you have a healthy relationship with your patient, they'll be able to heal more quickly because they trust the care that you're providing is in their best interest. And they'll be more willing to learn and possibly change their own health status through the resources that you provide. Just like with any other job, nurses may experience things in their own life which can, but shouldn't affect the care that we give our patients. Some of these examples could include problems at home, caregiver or compassion fatigue, physical, mental, or emotional burnout, or anything else that impedes a nurse's ability to provide the best care with an enlightened attitude. However, unlike most jobs, a nurse's primary goal should be to help their patient improve their own health. So we must not let outside influences affect the care of our patients. Nurses have the ability to lift a patient's spirit and brighten their day, which gives the patient energy and hope to keep working on achieving that optimal goal, or at least improving their healthcare status. So, some of the assumptions of my philosophy are that caring for patients in the community should be the central goal of nursing. Even if illness can't be cured, we still have to care for our patient and help them towards that goal, whatever it may be. The next assumption is that the healthcare provider must be able to recognize trends in health and changes in the patient's health status is vital to a nurse's ability to effectively care for and advocate for our patients. The next assumption is that nurses must be educated at a university level in the field of science and should strive to be a lifelong learner. Now, we know this because technology and health and everything that we practice is changing all the time. And it's important that we not only keep learning, but that we want to learn. The next assumption is that patient care coordination and application must be a team effort by all of the medical staff, nurses, doctors, respiratory therapists, physical therapists, and any other caregivers. So we have to learn to communicate effectively to ensure comprehensive care. The three building blocks of my nursing philosophy that I talked about earlier, compassion, anatomical knowledge, and the building of nurse-patient relationships, shouldn't be viewed as independent components, but a dependent and correlated with one another. It kind of takes all three to be a good nurse and to provide care at that level of comprehension that we are looking for. The patient must also have the energy and ability to heal, and the nurse must promote that ability through active communication and recognizing and correcting negative health trends early and effectively. So those are kind of all the assumptions of my philosophy of nursing. But I think that nurses should also focus on the broader picture of care. To be compassionate for your patient, you have to be compassionate for yourself. It's really important to take care of yourself so that you can take care of others. I think that it's also important to remember that medicine and nursing is not an exact science. That's why we say all the time that we're practicing medicine. And our methods and knowledge can change and can grow, and we just have to keep ourselves healthy so that we can keep up with those changes. So thank you so much for listening to my personal philosophy, and I can't wait to hear everyone else's.